Welcome to the Practical Behavioral Care Podcast. Before we begin, I want to share a brief disclaimer. This podcast is for educational and informational purposes only. It is not intended to provide medical advice, diagnosis, or treatment. If you have concerns about ADHD or any mental health condition, please consult a qualified healthcare professional who can address your individual needs. Today's episode focuses on ADHD, attention deficit/hyperactivity disorder. ADHD is often misunderstood and brushed off as simply being distracted, energetic, or unmotivated. In reality, it's a well-established neurodevelopmental condition that affects attention, impulse control, and activity levels. While ADHD is commonly identified in childhood, many people continue to experience symptoms into adolescence and adulthood. These symptoms can shape how someone learns, works, manages responsibilities, and relates to others. If you or someone you care about is navigating attention challenges, understanding ADHD and how it shows up can make a meaningful difference. ADHD doesn't look the same for everyone. Symptoms generally fall into two broad patterns: inattention and hyperactivity with impulsivity. Some people experience mostly one pattern, while others have a combination of both. Inattention may show up as difficulty focusing or staying on task, becoming easily distracted, forgetting daily responsibilities, struggling with organization or time management, or frequently misplacing items like keys, phones, or paperwork. Tasks that require sustained mental effort can feel overwhelming, even when someone is motivated or capable. Hyperactivity and impulsivity can look different depending on age. In children, this might include constant movement, difficulty staying seated, or excessive talking. In adolescents and adults, hyperactivity often shows up as internal restlessness, difficulty relaxing, or feeling driven to always be doing something. Impulsivity may involve interrupting others, speaking without thinking, making quick decisions, or acting without fully considering consequences. Everyone experiences distraction or restlessness at times. With ADHD, these patterns are persistent, present across multiple areas of life, and interfere with daily functioning. There is no single cause of ADHD. Research consistently shows that genetics play a major role. ADHD often runs in families. Scientists have also identified differences in brain structure and function, particularly in areas responsible for attention, executive functioning, and self-regulation. Environmental factors can contribute as well. These include prenatal exposure to alcohol or tobacco, low birth weight, premature birth, and early childhood stress or trauma. ADHD develops through a complex interaction of genetic, neurological, and environmental influences, which helps explain why symptoms and severity vary so widely from person to person. Diagnosing ADHD involves a careful and comprehensive evaluation by a qualified professional. There is no single test that confirms ADHD. Instead, clinicians gather information from multiple sources. This usually includes a detailed medical and developmental history, standardized symptom checklists, behavioral assessments, and observations of how someone functions in different settings, such as at home, in school, or at work. A key part of diagnosis is determining whether symptoms are persistent over time, appear in more than one area of life, and significantly interfere with daily functioning. This thorough approach helps ensure an accurate diagnosis and rules out other conditions that may look similar. ADHD is a recognized medical condition, and effective support is available. Early recognition and intervention can make a significant difference. Treatment is typically individualized and often involves a combination of approaches. Behavioral strategies and skills training can help improve organization, planning, and time management. Therapy, including cognitive behavioral approaches, can support emotional regulation, coping skills, and self-esteem. For many people, medication is a helpful part of treatment when recommended and monitored by a healthcare provider. Support also extends beyond clinical care. Educational accommodations, workplace supports, consistent routines, and family understanding all play important roles in improving daily functioning and quality of life. ADHD can feel challenging, frustrating, and at times overwhelming, but understanding it is the first step toward managing it well. With the right combination of education, practical strategies, and professional support, people with ADHD can thrive and build lives that reflect their strengths. If anything in today's episode resonates with you, consider reaching out to a healthcare professional for a full evaluation and a discussion of your options. Thank you for listening to the Practical Behavioral Care Podcast. Until next time, take care of yourself and keep moving forward.